Hello, everybody. Thank you for being here today and joining us for this webinar. My name is Maria García Puente. I'm a medical librarian from Spain and I'm coordinating this program. This webinar is part of a CPD pilot program for the European Association for Health Information and Libraries, or EAHIL. I welcome you on behalf of the EAHIL President, Board and Council who have initiated this pilot. The idea is to offer EAHIL members access to continuing professional development resources in addition to what is provided in the journal and at the annual workshop and conference. We have a large membership and not all members have access to local professional learning activities or are able to travel to the annual EAHIL events. For this reason, we are piloting an initial series of short webinars. Each webinar will consist of a presentation of 40 minutes, followed by a Q&A session. As this is a pilot, we will be asking for your feedback so we can determine how to improve this program and whether this is something EAHIL members would like to see further developed in future years. You will be invited by email to give feedback after attending the sessions. In case you are not already an EAHIL member, you should know that it's free to join, and I hope you will join today. Marshall Dossier, President of EAHIL, will be here with you after the Q&A session to answer your questions about EAHIL. So we can start then. Our first presenter is Dr. Andrew Booth, a librarian and review methodologist who specializes in advising on review types. Along with colleagues at the School of Health and Related Research at the University of Sheffield, he has authored a book to help you make such choices. In this seminar, Dr. Booth will share his expertise to help you better support your users when facing the task of literature review. Dr. Andrew Booth, thank you for sharing your knowledge and your time with us. It's an honor to have you here inaugurating this program with the webinar 50 Shades of Review. We are looking forward to hearing from you. Welcome.
Thank you very much, Maria, and thanks to Maria and Marshall for their preparatory work on this exciting first pilot of CPD for EAHIL. It's a great privilege to have been invited to kick off the event. So I hope you're all here because you are expecting to learn about different types of review. I'm very aware that the way we publicize this means that we might get some of you attending for other reasons, but this is on work time. So I'm going to start with a little story. In the beginning, there was a single product, and as long as you chose to have the product or not to have the product, life was very simple. That was true of this fizzy drink. Other fizzy drinks are, of course, available. But life now is much more complicated. One can get caffeine-free, cherry, diet, vanilla, and in fact the same multi-headed corporation can also offer Dr. Pepper, Fanta, Lilt, Sprite, etc. So life has become complicated with choice. Let's move this to what you've come to attend for, and this is another parable. In the beginning, there was a single product. It was very successful. People know what a Cochrane review is. The choice was simple. You do a systematic review or you do nothing. Life was very simple. But life has become complicated for us, complicated for researchers, complicated for librarians. How do we choose which review to use? What are they for? How could we help to decide what the appropriate literature search techniques are for each type of review? And it's complicated because the brands of review, if we can call them brands, some of them are named by the time they take, some of them are named by the purpose that they are there for, others are associated with the type of included studies. Some, like Cochrane Review, are named by the organization, true to of Joanna Briggs Institute Review, and some by the type of synthesis, in other words, the technical process that takes place within the review. So not only are the labels multiple, but each label focuses on a different aspect of the review, making it difficult and challenging to compare. And nearly a decade ago, along with Maria Grant, the editor of Health Information Libraries Journal, we wrote an article for Health Information Libraries Journal which showed that many people use labels, but in many cases these labels overlap. In other cases, it's not clear why the label has been used. And so two people could be using the same label, but be describing different methods. But the good news, highlighted in green, is that some common features do exist. So there is enough characteristics, similarities to be able to identify factors that help us to choose review types. Now, I entitled this 50 types of review. If I spent a minute on each type, we would go over time. Actually, you've been cheated a bit because when I reviewed this presentation at the end of the session, I could only count 49 types of review, but I hope you will forgive one review between friends. So rather than try and go through 50 types of review, I'm going to go through 6 families of review. So we're going to be looking at the main types of family, and this is a way for you to have clear in your mind some of the differences between families. And so the 6 types we have here, the traditional reviews family, represented by a guru. So these are done by experts. You believe this review because it was done by an expert. The systematic reviews family, very technical and academic and precise. The rapid reviews family, reviews with running shoes. My colleagues on the Cochrane Qualitative and Implementation Methods group will have to forgive me, but for the nice touchy-feely material of qualitative research, I've chosen the hippie icon. And what about the mixed reviews family, where you have part quantitative, part qualitative? That is why we have the mythology of the centaur there. And then some reviews are very muscular, they're for a specific purpose, a specific audience. And so the way that those reviews are designed is absolutely tailored to that particular audience. So that's our starting point, 6 families that we're going to navigate through briefly. And I will pick out some of the members of the family, some of the more distinctive individuals, without, as I say, covering all 49 types in detail. The good news is that there are further resources that will help you to explore these types in more detail, particularly the choice between them. So let's start with the guru. I'm not going to spend very much time on this. The idea of this is that an expert very often selects the materials that they are going to write up in their article. They provide a summary. They criticize the articles. We don't know how they've searched the literature. We don't know how they've decided which studies are going to be included and which are not. They are showing us the world of literature through their own eyes, through their own lens. And this is where we were in terms of literature in the past. And for those of you who are interested, because many academic organizations still require traditional reviews, I have recorded here some of the sources where you would go to find characteristics of a traditional literature review. So just because they are traditional, that they are not novelty, doesn't mean to say they don't have any place in the whole review ancestry, but their place is very limited. And so this extract, this table, shows the different stages of research and the characteristics of each stage in a traditional review. So you will want to check out these resources if you're interested in covering traditional reviews. But our focus is more on the new types. And so here we have the systematic review family, these more academic products. Foremost of these was, of course, the Cochrane Review, as we mentioned at the beginning. We can see that some of the products are about the stage of the review. So increasingly, people are publishing their review protocols, their plans on how to conduct a review, which means that as librarians, we can view these protocols to see if they are similar topics to reviews we're being asked to do. And even though the review itself has not been completed, we can learn from their methods, we can adapt their methods for our own purposes. And these review protocols are available through such resources as the database Prospero from Center for Reviews and Dissemination, and are also published in some journals, like the one that I'm an editor of, Systematic Reviews. And then we have other products here, Review of Reviews, Umbrella Review, meta-analysis. So I'm going to just pick out a few of these more common ones and just give you a description of them. But we did ask you to complete the pre-course questionnaire. And so I'm going to review responses. These aren't for all the participants. I believe the number of registrations is well over 300, but this gives us a picture of what people's views are. So we asked you the question, why is a systematic review, so members of this family, considered the most rigorous type of review? Many of you realized that just because you take more time over a review doesn't necessarily mean that you're producing a better quality product. Obviously, it may mean that you are more thorough, but it doesn't guarantee it. It's interesting to see that you realize that just throwing money at a review doesn't make it good. No one chose to define a review just in terms of how much money you spend. So the main answers here are divided between those of you who feel that by searching more databases, you can be confident you've found all the relevant material, and those who realize that the review is there to minimize bias. So if we look at a definition of a systematic review, we see that although assembling the evidence is an important part, so finding the databases, finding the studies is important, that the characteristics of a systematic review are all around limiting bias. That bias is limited not just in the databases used, but in the follow-up processes, how we assess the literature, how we bring that literature together, how we interpret that literature. All of that must exclude bias. So in summary then, in response to your pre-course questionnaire, more time doesn't necessarily mean better quality. More money certainly doesn't mean better quality. Searching more databases does not necessarily make a better review. And I'll just share with you some recently published information here that actually a typical information professional will only find 55% of relevant studies through a Medline search. So they're missing a large amount of studies that are there, but they don't retrieve them. However, searching additional databases will only add another 15%. So the take-home message, the practical message here, is that doing a good Medline search will make a more difference to a systematic review than searching multiple databases. And this has been shown across a large number of topics. So typically, 85% of studies for a systematic review can be identified in health from Medline, and so doing a search that retrieves that 85% is more important than doing additional databases to find the remaining 15%. So the systematic review defined a clearly formulated question. Many of you will know PICO in connection with evidence-based practice. A clearly formulated question. You clearly identify the studies for inclusion. You select those studies. You critically appraise them. And you use these reviews when you have a very tight question, when you're seeking the best currently available answer to help support decision making or see where the evidence takes us, and therefore what else needs to be done in order to answer and resolve that question. And you could just look anywhere in the Cochrane Library for a systematic review. The advantage is that they all are structured the same. They are all performed to the same methods. And the main method sources are listed here on the slide: the Centre for Reviews and Dissemination and the Cochrane Handbook. And when we look at the systematic review process, we see the importance of these different stages in eliminating or limiting bias. So we're trying to find all eligible studies. We're not just looking at part of the picture. We have clear criteria for including them. We extract data so that the studies can be compared. We use the same checklist to compare the quality of the studies, and we then look to see any uncertainties through techniques such as statistical techniques and sensitivity analyses. So that's the vanilla flavor. That's the original traditional flavor. What other forms of systematic review do we see? Well, as more systematic reviews are available, we now see a new creation called the overview of reviews. So instead of someone having to look through every single individual study, they look through every single systematic review on the same topic. So they are getting an instant overview of the evidence rather than having to wade through the individual studies. And so if 2 or more systematic reviews have already been conducted, there is a strong argument for not repeating another systematic review, but for using those systematic reviews, taking stock of what has already been done. This means that they do have to be sufficiently comparable. We start to see these overviews of reviews appearing in the Cochrane Library. I've given one example in the top right corner. And we're starting to see details on how you do these reviews. There's a very good article by Smith, 2011, on how to conduct an overview of reviews. And I'm currently looking through the current draft of the update to the Cochrane Handbook. So the version that you have is available in the Cochrane Handbook, but the chapter overview of reviews is currently being revised for the next version, and I was reading it only last week. So when we get beyond the systematic review family, then life starts to get a little bit more interesting, a little bit more complicated. We can see that a number of these labels have speed in the title: rapid review, rapid evidence assessment, rapid response, rapid realist synthesis. And some of these indicate the level at which we're analyzing the data. So inventories, maps. So the idea is that we're not going down typically to the results of individual studies. We're just trying to get a picture of what those studies show us, the quantity and quality of the literature. Some of these also indicate that as well as being done quickly, these have been done in a very shortened form. So we have the words evidence brief. We could also have things like policy briefs that appear later. But we asked you which of the following statements best describes a rapid review. And not surprisingly, you thought that the best answer, although you were quite evenly split between this and other answers, you thought the best answer was a rapid review. Surely that means a review that takes less time than a systematic review. And I can see why you answered that, because on average, a rapid review will take less time than, on average, a systematic review. But the time taken is not the characteristic. A systematic review, if you threw lots and lots of resources at it, could be done in 3 months. A rapid review could take anything from 1 week or even several days through to 6 months. So when we get to that overlap period, we see we can't distinguish between a rapid review and a systematic review purely by the time it takes. So I can see why you had that answer, but if you look at the work of the Cochrane Rapid Review Group, you'll see, and we agree when we teach our one-day rapid review course here in Sheffield, that actually the rapid review is seen by the fact that it has a specific purpose that has to be tailored to those who have commissioned the review. And we see that more clearly from the next slide. Unless you have a really detailed knowledge of what the user wants, you would not be able to do a review rapidly. You would just do a bad review. And bad reviews maybe is the 50th type. I didn't have that as a label. So you can only perform a review rapidly if you have a detailed knowledge of the user requirements. They have a detailed understanding of the methods you're using. And although, because you're doing this within a different time scale, you're less likely to remove all the areas of bias as you would do with a systematic review, that you at least tell the customer what the main areas of bias are. And so in our short course, we actually say you may have to report your methods more clearly for a rapid review than for a systematic review, because people need to see how you've tailored the review to the user's requirements. And so good communication around important review decisions is key. Now, we perform rapid reviews for the National Institute of Health Research here in the UK, and we spend a lot of time on the telephone writing protocols, sharing with them information on different options and how they can or partly will cover the requirements of the reviewer. So we can't distinguish a rapid review on price, because it could actually be more expensive than a systematic review. If you want a clear answer in a very reduced time period, you might have a larger review team. So you could be spending the same money in a shorter period of time. You could be spending more money. On average, and so in this extent, if we're talking only on average, people are correct. A rapid review will take less time than a systematic review, but averages lie. A rapid review could take as long as 6 months. A systematic review could take as low as 3 months. So we can't distinguish rapid review purely on time. And we also had the database issue here. Some approaches to reviews actually search as many databases as a systematic review, but then do less with the material they find. So we can't say that all rapid reviews search fewer databases. If we're mapping an area, we could actually search the same number of databases, or could even search more databases. Bear in mind that systematic reviews tend to search 3 or 4 databases on average. So searching less databases for a rapid review would be a very low figure indeed. So the take-home message number 2 here is that the main difference between rapid reviews and standard systematic reviews, and this comes from a very recent piece of research, is the close relationship with the end user that allows you to shape your review to the specific needs of the user. And so it's very important not to think of a rapid review just as a mini systematic review with corners cut or bits cut out. It is a product in its own right, and we design our rapid reviews from scratch. We don't just cut bits out of a systematic review. And how do you do a rapid review? Well, there are three ways that you can do a rapid review. You could throw more resources or people at the review. And so when we did one for the NHS England, we used 6 reviewers instead of 2 reviewers. We did a full systematic review within a 3.5-month period by throwing more resources at it. But other possibilities, particularly of interest to librarians, are to work smarter. So to use technology to make the process more efficient and speedier. So there is a lot of interest in ways of data mining. So instead of looking at all articles on a topic area, as we have to do for a systematic review, you might go down a list in decreasing order of relevance to a predetermined point. And you say, when I get below that point, I'm going to stop looking at the literature and I'm going to get on with analyzing what I've got. But then the third area is an abbreviated rapid review where we take a shortcut or maybe more shortcuts to make the process speedier. An example of that from the non-searching part is that we often in a systematic review have 2 reviewers looking at materials so that we can see whether they agree or whether they bring in bias. If we're doing that process rapidly, we might only use 1 reviewer for that, but we would tell the customer that our results are less certain because we have only used 1 reviewer. I know a lot of you are being asked to do scoping reviews, and scoping reviews and mapping reviews are often confused in the literature. Here in SHA and in the book that we've written, we make a clear distinction. It's a helpful distinction because librarians have always thought about scoping as a preparatory process of doing this before you get on with the actual real work. And so we stick to that point. So a scoping review is often some preliminary work designed to assess the size and scope of the literature. So behind a scoping review is the idea that if the scoping review answers the questions about the quantity and quality of the literature, then you might go on to do a very precise systematic review. It is preparatory. A mapping review isn't necessarily aiming to answer a specific question. It's trying to characterize the literature in the form of a map. We've done this recently for the Wellcome Institute. We've been doing a mapping review on diversity and ethnicity in research. And one of the things we've delivered to them is a database of references and things like graphs, things like tables to show how the literature is distributed. Not so much the results of the literature, but what the literature looks like. So this won't answer the question of, does this approach work? It will answer the question, what approaches have been used and what gaps still remain? And there's a lot of interest in this approach outside of just the health field. So we can see that some of the best guidelines on doing mapping reviews are produced in the field of conservation. I'm going to briefly mention this just because of the high profile of it. The rapid evidence assessment is a stylized form of review designed to provide instant answers to government decision makers. And so we were asked to do a rapid evidence assessment for our Home Office, our, I suppose, Department of Internal Affairs, to use other countries' language. So we were asked to look at the effect of pricing of alcohol on crime. So if you make alcohol cheap, does that lead to more crime? The government wanted a clear picture of not only what the evidence base looked like, which would have just been a mapping review, but also what the evidence says. They wanted this done within a short time period. We needed a good understanding of what they wanted and why they wanted it, so we performed a rapid evidence assessment. And these rapid evidence assessments have been accepted by, for example, the UK government, but also by other governments as a special product in their own right. And you can see that the UK civil service have resources specifically on how you do a rapid evidence assessment. So not just mapping the literature, but also giving answers to inform decisions. We're now moving on to the HIPPY, and I could spend days on this topic, not just minutes. The qualitative systematic review family is the big growth area. People have invented a number of terms on the left-hand side, essentially meaning the same thing for describing the whole family. And then we have the different children on the right-hand side, each of these with a different method. The good news is that I have recently produced some guidance on all of these methods for a European Union project, and that is available on the web, and I'll share that with you later. But a qualitative systematic review isn't trying to answer the question, what works? It answers questions like, what is acceptable? It answers questions like, what are the barriers? What are the facilitators? What makes things more likely to work? These are very popular because they tell us what the public or patients or carers want. And there's a very good example now in the Cochrane database on looking at the barriers and facilitators to using lay health workers instead of professionals to deliver maternal and child health in lower and middle income countries. As I say, this is a whole topic in its own right. We teach a 3-day course of this here in Sheffield. So if you want to look at some of the methods and resources, I can do little better than point you at our Cochrane Group website. And I mentioned that I'd produced some guidance. And so what this table summarizes, although there's accompanying text, is that for choosing a particular type of qualitative systematic review, what are the factors that you use to choose? So you'll see across the top, I'm not going to spend much time on this, but across the top are the different types of review. Down the rows are the different factors, so that you can see the first factor here is question type. Some are exclusively for qualitative and others can be used for multiple types of evidence. You can see the next thing is the type of question. Does it have a fixed question, an equivalent of a PICO, or does the question emerge as you do the review? And so another factor we have here is the time required. I've tried to distinguish those that take a lot of time, indicated in red, and those that are relatively shorter in time, indicated in green, and then we have the middle category. So this is a useful resource for your researchers in deciding which methods are most appropriate for their type of review. And I've also summarized some of the functions of these different types of synthesis. So, for example, you can see I've indicated with a green cross the methods that rely on a comprehensive search, similar to a systematic review search, the methods where you can actually have a purposive sample of the literature, and this helps you decide what sort of literature searching to accompany a particular type of qualitative systematic review. If this family looks too big for comfort, if it's breaking out of the house, if you like, then this diagram will help you. These are the steps that are present in all methods of qualitative systematic review. They may take place in a different order. They may have more or less time in some cases than others, but the ingredients are the same. So it's often helpful, particularly with regard to the searching part, to see what is required for identifying the relevant literature. Now, I asked you the question as a pre-test, which of the following methods cannot be used to bring quantitative and qualitative studies together within the same review? Many of you correctly identified that meta-analysis is a quantitative method. You could comment on the studies, but you couldn't actually bring the studies together within the same review. And so that was the correct answer there. And here is the justification. So meta-analysis is a quantitative statistical analysis, but you'll see I've given you examples of narrative synthesis, realist synthesis, and narrative summary to demonstrate that you can include both quantitative and qualitative in the way you describe them. So narrative synthesis, you just summarize the number of studies, their characteristics in text in this particular way. I hope you're still with us. We're getting towards the end of our exploration of family trees here. So we move into the exciting area of development, mixed methods reviews, which are about bringing together the quantitative reviews, like Cochrane reviews, and the qualitative reviews, like those that study people's views. And so we not only find out what works, but also what people think of it. And so we've already mentioned some of these methods. Realist synthesis, this is a current growth area. Essentially, a realist synthesis is trying to answer the question, what works for whom under what circumstances? It answers the what works for whom using the information from quantitative reviews. It uses the under what circumstances from qualitative reviews and builds a bridge between the two parts of the question. And so a realist synthesis uses the terminology CMO. If ever you see context, mechanisms, outcomes, that is a real sign of a realist synthesis. The where, the how does it happen, what does it achieve? And this has been an area where training materials have been developed, and I have compiled, along with materials from other people, a search resource, Realist Search, a wiki to help librarians involved in realist synthesis. It's true to say that ways of bringing together quantitative and qualitative information were fairly primitive in the beginning, and what you would often do would be to do the two processes separately, so intervention studies and non-intervention studies, or views studies, attitude studies, and then you would look at the two reviews and bring them together in a third review, as in this particular slide. But increasingly people are interested, can we bring the material together earlier rather than waiting till we've got through the intervention review and the views review? Can we bring the information together at the time of reviewing rather than at the end, and make the process quicker and more meaningful? And that's what we're looking at the moment. On to our final family. Now this is very specific to the purpose that you need to perform. It includes things like health technology assessments, which are specifically for technology assessment agencies to answer a complex clinical and cost effectiveness question. It includes policy brief for politicians and decision makers. But it also includes reviews, some of which we've developed ourselves, to examine, for example, whether particular things operate together, correlates review, or a recent one we've done, which is to look at what resources need to be in place to move a service from hospitals to primary care. So that's a logistics review. It uses very low quality evidence, but it's very informative in terms of what does a GP team need to think of if they're thinking of introducing diagnostic services into their practice. And then there's concept analysis. If people argue about what a concept means, then concept analysis is a formal way of exploring that. And we've done that with terms such as context and implementation. So how do you decide which review type to use? Many of you will know that I love my acronyms, and here we have one, RETREAT. The factors that determine which review type to use are RETREAT, research question, the epistemology, in other words, the type of knowledge, the time, the resources, the expertise, the audience and purpose, and the type of data. So take-home message number 3 is think RETREAT when you're deciding what type of factors you take into account for your review choice. And another acronym that we shared with you as part of the pre-test is SALSA. We've said that labels don't always help you to decide what type of review is which. So we've devised this acronym. It was first used in the article by Grant and Booth that we mentioned earlier. This actually stands for, and the majority of you got this question right, and I can be very definitive in the answer as we invented it. So it's search, appraisal, synthesis, analysis. And so rather than just go on the labels, it's helpful to think how much searching is there in the review, how much assessment of quality, how much time is spent looking for patterns, how much time is spent analyzing and interpreting the patterns. And so you can form a picture, a sort of graphic, if you like, in your mind about how much effort is put into these 4 stages. And so the inspiration for this is this particular framework that we reported in a very well-cited article is the graphic equalizer that you have on some stereo systems. So here you can see the 4 elements, and so in the top part of the picture for a mapping review, searching is very extensive, appraisal is often non-existent, synthesis is moderate, analysis is fairly superficial. For a systematic review, that's our benchmark of intensive searching, intensive appraisal, intensive synthesis, intensive analysis. And I'm looking forward to developing more of these profiles for the 50 shades of review. They won't be 50 shades of grey, there'll be 50 shades of red, yellow and green. And I look forward to working with you in defining these types in terms of the 4 processes. So we've said there's a bewildering variety of choice, and people have started to write articles and books to help us navigate around this choice. And so this resource list will be useful for your users and for yourself in learning more about the different types of review and what they're used for. Part of those resources was designed for a project with collaborators at the Institute of Tropical Medicine, where I made an attempt to try and characterize the average times taken for particular types of review and put those into a chart. And indeed, colleagues at Public Health England are very interesting in this way of defining reviews by the time taken. If you want to practice your ability at deciding on the different types of review. In the second edition of our book, we've got some teaching materials where we describe a review, we say the factors that you should think about, and then provide a suggested answer. And so there are 7 scenarios there for you to practice your choice of reviews on. Just going to conclude now by stating that the area of reviews is a huge growth area for health librarians, that although in the past we've concentrated on those areas marked in green here, literature searching, managing the references, supplying the interlibrary loans and articles, there is the potential there for us to move into the yellow areas, actually leading literature review projects and writing reports, but also into some of the more technical areas. And many of my colleagues here at SHA are now doing the areas marked in red as part of their contribution to literature reviews. And it has a large effect on their profile within the organization. If you're interested in expanding your role as a librarian or information specialist in supporting reviews, there are some articles which describe these roles, including new ones on the right-hand side on how you can contribute to a scoping review and how you can contribute to a mapping review, both from the JMLA recent issue. But ultimately, a review is only going to be as good as the process that goes into it. And so I'm going to conclude with this cartoon. It's all original research that I've located for my review. I had no assistance when I looked it up on Wikipedia. Thank you for your attention. I look forward to your questions.
Thank you very much, Andrew. Just to check that you can hear me as I'm speaking, Andrew.
Yes, I can. Thank you, Marshall.
Great. Thank you very much for that excellent presentation. I think you probably can't hear it, but we've got applauding happening around the internet here from all of us attending.
That's lovely. Thank you.
Now, we have a number of questions here. What I'm going to do is run through them in the order in which they were asked. So we've got a handful. It's not a huge number. First question was from Jacqueline, and she's asking about a particular reference and wants to make sure that in the reference list that we have somewhere the reference for the paper that was referring to the percentage of relevant papers found in Medline versus other databases.
Yes, I realized as I was presenting that that was actually originally just for illustration, but as good librarians, you want to know my source. So yes, I can certainly add that reference. For those of you who like doing this thing, it's actually in the Journal of Clinical Epidemiology. It was published 3 or 4 months ago, and one way of finding it is by looking for my own correspondence in reply to the original article, where I shared some of my unpublished data from a Health Libraries Group conference, where I looked at the same issue and came up with very similar numbers.
Okay, great, Andrew. I wonder if you would be willing to add the reference into the slides, and then are you okay to share the slides?
I shall do that immediately, and apologies for my oversight. There was
a lot
to juggle there.
Part of the reason for me asking about the slides is that we've had a number of questions asking if you would be willing to share your slides, because there were quite a few references in there, and I'm also interested in looking at some of them myself.
Great.
So next question from Kate. She has asked, regarding overviews or reviews or umbrella reviews, what are the implications of amplifying any possible biases from the source reviews in the overview?
Yes, that's a very good question. It's very important when you're doing any systematic review to have procedures for judging quality in the presence of bias. So if you're doing an overview of reviews or an umbrella review, just to distinguish there, an umbrella review is where the reviews have been designed to fit together and very often have common methods, whereas an overview is more a fortuitous pick of what's available on a particular topic. But when you're doing an overview of reviews, you use checklists that assess the quality of reviews. One is called AMSTAR, AMSTAR, and so you assess as the questioner suggested, you assess each individual review and assess the potential bias of each review. Of course, you do have the advantage that you can play the reviews off each other to, if you like, provide a check on each other's quality. So if, for example, two reviews come to a different assessment of the same study, they both included it, then you can actually use that as a way of signaling questions about the quality of one of those reviews.
Okay, excellent. Thank you very much. I'm just going to rattle through these questions.
Yeah.
Next question is from Judy. She's asking about overviews and umbrella reviews also. She asks, should we also search for more recent studies published since the reviews? Because some overviews do and some do not.
Yeah, no, that's a very good point. It obviously depends on how recent the coverage of the reviews is. We did a review on group clinics where we actually mapped all the included studies to see from the most recent reviews what studies were included. And as you would expect, as the reviews were more recent, more studies were included. So you can do that initial mapping. And if the most recent study is, in your opinion, too old, then you should certainly do a review update. And of course, one way you can do that update is not necessarily just replicating the search strategy if it's published, but you could actually do citation searching for the reviews to see new studies that have come out since the most recent of those reviews.
Excellent, thank you. Next question is from Hannah. Oh, sorry, I'm sorry. Next question is from Judy. And she's asked, do you have any top tips for persuading customers to fully consider which review type would best answer their question and not to try to cut corners, like we'll do a quick rapid review?
Yeah, I suppose my view on this is changing a bit, that as long as you give them a full health warning about what the limitations are of the cuts, essentially a just-in-time answer is much better than a just-in-case answer, because a just-in-case answer won't get used. So if we have to do a just-in-time answer, then our responsibility is to do that as best as possible. So my top tip would be that you spell out exactly the implications of what they will get and what they won't get from choosing a review method that is other than a systematic review. And if they're prepared to live with that uncertainty and that possible bias, then that is their decision. So essentially, we shouldn't determine their choice. We should just make sure that they're fully informed when they make that choice.
And then they take the responsibility for the methods.
That's right. And we make sure that we write the limitations up as part of our documentation, both for the search strategy and for the review as a whole.
Great. Now, next question from Hannah. She says, the concept of the purpose-specific review sounds, I'm sorry, I'm not reading her question well. The concept of the purpose-specific review sounds a little similar to the rapid review, i.e. dealing with a very specific thing for specific organizations or individuals. And she asks, are we splitting hairs here a little? But she says this is all very interesting.
Right. No, I mean, essentially, as with many families, there is some interbreeding going on. And so, yes, when we compare, for example, the policy brief, which is in a very clearly defined area, against a more generic evidence brief, which is available as a general support tool, then the distinctions in terms of the methodology do start to get a bit woolly. So I can agree that those distinctions are not always clear. I think the purpose specific, though, do not necessarily always have an expiry time or expiry date if they're not necessarily time critical. So a concept analysis could be done over an extended period of time. The important thing is that that it is doing a very specific purpose. It's not going beyond that purpose. And so the method has been designed purely to support that purpose. But yes, I agree. As I say, there's lots of inbreeding going on across the families.
Thank you very much. Now, Winnie was asked, just to confirm, Winnie, we will be sending the slides out. So that question answered. Next question is from Lorna. Can a review be systematic if it is conducted by one person for academic purposes?
This is a real challenge, because we get our students, for example, to do PhDs or master's dissertations on their own, and of course that makes it difficult to publish because of the expectation that two people are involved. I think in the past it was felt that a systematic review had two people doing all the key processes, although ironically not the searching part. But from that point on, there was parallel work through the various stages. Increasingly, there's recognition in systematic reviews that these are choices that you make. So, for example, you may start to use two people for critical parts of the process, not for all parts of the process. You may sample from the selection decisions to check one person, or you may have one person who is just checking another person's work. So there are lots of flexibility now within the systematic reviews template, a lot more than there used to be. But strictly speaking, because a systematic review is taking strategies to limit bias, you would expect to see two people doing a lot of the critical parts of the process. Incidentally, we are currently looking at adopting student reviews, in other words, repeating some of the process with a second reviewer to make them publishable. So rather than two people working on them at the same time, having two people working on them staggered to introduce the quality that is characteristic of limiting bias.
Thank you. That's certainly a problem we have here with student work. Sorry if you have background noise from my microphone. I'm going to take two questions next from Isla. Her first question is, do the actual search strategies for systematic review or rapid review or realist review, etc., look different? And second question is, why have the Cochrane stopped being so consistent in their inclusion of full search strategies in their published reviews?
Okay, so first, well, I'll take the second question first. So I think any inconsistency within Cochrane is a cause of concern, both for users of Cochrane and for the collaboration itself. And so a recent initiative has been the Messier standards, which are trying to make standards more consistent across reviews. So although I appreciate that as librarians we're dealing with the current outputs of Cochrane, I think the situation that's being described is being tackled, and so we will move to a situation where there is more consistency. And I know people like Carol Lefebvre and Julie Glanville are doing a lot to ensure that the standards are consistent for the searching part of the process as well as for other parts of the process. In terms of reporting, if you think of the SALSA diagram of the four different processes, it's clear that you can be doing very extensive searching for even a rapid review. It may well be that it's rapid because you spend less time on the other parts of the process. So there's no real justification for varying the search strategy according to the type of review you're doing. But there is a justification for varying it according to what we've already discussed, which is what the commissioner wants and the implications of that for its quality. So, for example, in the NICE process, the National Institute for Clinical Excellence, where they are doing, if you like, rapid health technology assessments, there is a requirement for that search part of the process to be as good as for a longer review, because if it wasn't good, they would be open to criticism. So I think it's more about the level of search reporting detail matching the purpose of the review and how it's going to be used, rather than simply mapping the type of review.
Thank you. There are a few questions, additional questions coming in through the chat, but we may not have time to deal with them all.
That, yeah.
We've gone over the hour now, so I'll just pose you the last questions asked earlier. Stefan has asked, he says he didn't fully understand why you would only use Medline and sacrifice the other 15% of studies that could be found in additional databases.
The choice of whether you sacrifice the 15% is to do with those designing the review. The point I was making is that one's time is better spent in doing an intensive search of Medline in terms of included studies than the time spent where librarians have traditionally focused on the sort of big is beautiful, look at my list of databases. So I'm not suggesting that you would sacrifice the 15% if you've got the resources to look at the 15%, and if you've already done a cast iron Medline search. What I am saying is, if your choice is between improving your Medline retrieval and perhaps having to go through more articles to find the studies, or extending to other databases, then the Medline will yield nearly twice as many included studies as searching other databases. By definition, the other databases are of decreasing relevance to your topic. That's how we select them, and that's how we work through them. So as you get further down a list of databases, your yield is becoming less if you've designed the search strategy well. How far down that list you go is to do with the resources you have available. Just as I mentioned, how far down a list of references reviewers will go in the future will depend on how long and how extensive they're prepared to search.
Okay, one last question, and then finally I'll share a comment with you. So the last question is, are there standards for these review types?
Well, no one has sat down with the 49 review types that I've outlined to you all today and said, let's produce standards for all of these. What has happened is that as a review type becomes more popular, then groups realize that it becomes important to communicate how they're done and how they're evaluated. So as you will see from my slides when you review them, where standards are available, I have shared references to these. In some cases, those standards are the result of people just reviewing current practice. So they are real-world pragmatic standards rather than aspirational standards. What ideally we would like is the equivalent of the Cochrane Handbook, which is the aspirational standards of saying how things ought to be done rather than just simply how they are done. So the picture is very uneven. Ideally, we have standards that ensure the quality of each of the methods. What we typically have are groups of individual researchers reviewing an area and just recording what's been done. And in some areas, the methods are so new that the standards haven't yet appeared. So this is a changing area. Where they do exist, I have put them up on the relevant slides.
Okay, thank you, Andrew. And the comment that I wanted to share with you was from Kate in response to one of your earlier questions, answers. And she was saying that she wonders if you could also use the ROBUS tool, so the risk of bias assessment tool.
That's absolutely correct. Thank you for that, Kate. Yes, as with many of these review types, when you come to reviewing particular types of literature, there are multiple quality assessment instruments. That would be the subject of a whole different lecture, probably for a slightly different audience. But thank you for mentioning ROBUS. It certainly is worthy of mention.
Now, we do have more questions, and I want to ask you, are you willing to continue, or would you like to stop?
I have a few more minutes. I don't have a back-to-back meeting now. Perhaps another 5 minutes.
Okay.
But I'm also happy to look at the questions offline and draft some answers that could be added to the web.
Okay. Well, let's see how we go. The next question is from Dorothy, and she asks, is the Medline search improvement not dependent on the version of Medline, i.e. PubMed versus subscribed versions, or is there not a difference?
That is an important factor. I think it's very difficult to compare head to head because they have different facilities, different ways of working. So certainly there was the perception that PubMed was inferior to a published version or subscribed versions of Medline, but the development of their automatic term mapping has meant that the gap between them is less perceptible. I think the point about platforms is very important in a related context, which is that search strategies designed for one platform are not instantly transferable across other platforms. I think essentially what Dorothy is flagging up is that there is a need for further research on the influence of choice of different platforms of Medline. I still think that the important point is that as librarians, we always review how we search, but only about the records we have found. We ought to be reviewing more the records we haven't found, which you can only do when, for example, a systematic review is completed and you go back to see what records you missed from your original strategy. I think that would be a good way of professional development, would be, if you like, it's like they do it in the aircraft industry. They have near-miss reviews, and so I think anyone involved in searching where other sources apart from the database searching are used, for example, follow-up of references, would always do well to go back and see why were articles missed and what can I learn for my future strategy design.
Thank you. I think I'd like to finish on one last question and sort of comment from Claire. This is a really valid point, I think, and I'd be interested in your views, Andrew. She says, it's interesting to hear the statistics on Medline searches. Does this just apply to physical healthcare subjects? I'm wondering how that applies to mental health topics, where I always thought that PsycInfo was more comprehensive.
Right. No, that is a very good question, and we are actually learning more as more and more systematic reviews are being conducted. We have more of an evidence base around database coverage. What I would say is that in the study that I did, and I referred also to one that's been published elsewhere, but in the study that I did, I picked 5 reviews randomly in a variety of topics that are typical to those encountered by medical librarians. And although there were individual topic-specific differences, what was remarkable was in how many of those topic areas that the figures were similar. So essentially, we're not moving to a rule where you say that 85% of studies will always be there. There is still a place for the detailed knowledge of librarians on database coverage. The point is, though, that if Claire wants to establish the superior of PsycInfo, she could actually look at some published reviews and compare the yield of Medline versus PsycInfo. Just because PsycInfo may be more comprehensive doesn't mean to say that you wouldn't still achieve a figure in the realm of 80 to 85% on Medline for those same topics. So yeah, I think it does require further research, but as I say, over a sample of 50 reviews, 5 in each topic, and supported by the research that someone else has published earlier this year, 85% is a good mental benchmark to have.
Okay, yeah. I think we should stop there, or we will be having your questions for you all day, Andrew. I think we can call that an immensely successful presentation. I would like to give my huge thanks on behalf of EAHIL, the Council, the Board, and its members to you, Andrew, for inaugurating our webinar series here.
Yeah, how did that go?
Thank you also. Sorry, Andrew, please carry on.
Yeah, I was just going to say thank you, Marshall. It's been a great delight to re-engage with EAHIL, and I'm very looking forward to being in Dublin for the next session.
Excellent, thank you. And Maria, I would like to thank you and also your working group who have organized this continuing professional development pilot for us. And I'd like to thank all of you who have joined us today and shared your questions and comments. We've had a lively discussion here at the end. So thanks to all of you who have joined us. Now, please look out in your emails because you will soon be receiving an email from Maria. She will be asking for your feedback on this session, and we take your feedback very seriously. We are learning from these webinars how we should continue or whether we should continue doing things like this. So this is very important to EAHIL. And if you're not an EAHIL member, then we very much hope that you will consider becoming one, and there will be a link to information about EAHIL in the email as well. So thanks to all of you. Thanks again to Andrew and Maria, and wishing you good morning.
Thank you for coming today. Thank you, everybody. Thank you, Andrew.